do only those exercises which have been prescribed to you. The first exercise is supine pec minor stretch. Lie down on your back. Your arms should be beside your body and push the shoulders backwards so as to bring both the shoulder blades together in the midline of your back. The next exercise is Ofer Levy. This is the most important exercise, so try to replicate as shown. One extremely important point is you perform all the movements shown in the exercise with the normal side holding the painful side, and no effort should be made to lift the arm on its own by the painful side. Lie down on your back. Hold your painful hand with the other hand by applying all the force with the other hand and keeping the elbow straight. Lift the arm towards the head as far as possible. You have to do 10 such repetitions. After completing 10 rounds of this movement, you bring the hands in front of your face, keeping the elbow straight. Take the hands apart from each other, hold that position for 10 seconds, and then gradually holding the painful side with the other hand, bring it down. The third exercise is lower flies. After sitting upright and slightly retracting your shoulders, just bring the arm outwards so as to contract the muscle in between your two shoulder blades. The contraction should be felt in between the two shoulder blades in the lower half. The fourth exercise is resisted external rotation. For this exercise, one needs to bend the elbow of the painful side by 90 degrees and hold the forearm with the opposite hand. Now try to take your forearm outwards from the shoulder and resist this outward movement with the opposite hand. While performing this exercise, the elbow should remain beside the body and should not move. The next exercise is resisted internal rotation. With a similar position as the previous exercise, you have to move your forearm of the painful side inwards against the fist of the opposite hand and resist this movement by the opposite hand. The sixth exercise is isometric anterior deltoid. For this exercise, a small pillow or a roll towel can be used as a cushion which is kept on the wall, and against this the fist is pushed forwards with the elbows bent at 90 degree so as the force is applied from the shoulder without actually moving the shoulder, and the contraction should be felt in front of the shoulder. Alternatively, this exercise can also be done by keeping a hand in front of the fist. The shoulder should not move while performing the exercise. The movement shown here is only for demonstration purpose. The next exercise is isometric posterior deltoid. For doing this exercise, one should stand with the back against the wall with a pillow placed behind the elbow, and a backwardly directed push should be given on the pillow so as to feel the contraction at the back of the shoulder. The shoulder should not move while doing this exercise. The last exercise is isometric lateral deltoid. For doing this exercise, one should stand with the painful side facing the wall and a pillow tucked in between the elbow and the wall. In this position, an outward push is given by the elbow towards the pillow without actually moving the shoulder, and the contraction of this movement should be felt on the outer side of the shoulder. Thank you for watching the video.